So I recently got a horrible sick. It was flu, I'm pretty sure. I was taking a tearful course here in Prague, and during the course, someone got it, I got it, and other two got it. And thank God, I am recovering. It was probably one of the worst flu I've had in life. And it was my first time to be sick in Europe as a Japanese person. So today, I want to share the difference between European and Japanese medical system, as well as the culture that surrounds the medical system. Firstly, people in Europe, I've noticed, hardly go to doctors. According to my previous flatmate, unless you have a severe sickness, the doctors will shoosh, shoosh, shoosh. If you're just visiting a doctor for flu, they will just shoosh you. Or they would just look at you funnily, which is really refreshing for me because in Japan, almost everyone goes to see a doctor, even just from a common cold. There's literally a running joke about Japanese clinic. So I'm patient A, this is patient B, okay? I wonder patient C, where patient C is. Oh, he must be sick at home. You see, we're both at the clinic. What we are saying that the patient C or the person C is at home, too sick to go out of home, get out of home. So that's how common medical system is for Japanese people. Or if you're talking about United States, this must be like on a whole different planet. Yeah, this is on the same planet. So if you like a very good health care system, I suggest you move to Japan. It's so common, so accessible, even more accessible than in Europe. I haven't gone to a hospital or clinic in Europe yet, but I bet it's more expensive than Japan. I would just sometimes get a medical bill that's equivalent of like 2 cans of Monster Energy drink. And if you're from the States, it must sound crazy cheap. Sometimes prescription costs as little as that. 2 cans of Monster Energy drink. Doctor's appointment itself costs like 2 cans of Monster Energy drink in Japan. So the culture around sickness. In Europe, I've been told to just rest well at home, drink some tea, warm yourself, keep yourself warm with a blanket. That's what I've been told to do. So that's what I did. In Japan, no. If you get sick in Japan, everyone just tells you to go to the clinic, go see a doctor immediately. Just skipping all those resting phase at home. You just have to go to the doctor, you know? So that's a huge difference, probably. Oh, in the United States, probably it doesn't happen. Nobody goes to the doctor for common cold. My dad always goes to the doctor immediately to get some shots from a common cold. It's a thing. It's common for Japanese people to go to the doctor immediately like that. Now this seems like a perfect country. Why did you move from Japan, Taiki? Well, there are several reasons why I didn't actually like this culture. I'm talking about the culture itself, not the medical system itself. I already talked about the medical system. It's amazing, it's affordable, it's accessible to everyone. So it's really good. I don't deny that. I'm not entirely anti-Japan. There are things that I say it's good, but there are some downsides I've noticed in this perfect healthcare system. If you're sick, if you have flu, you have to drag yourself out of the house and go to the hospital or clinic if you don't have anyone to take you there. And my experience, it was horrible when I had a flu. I had to just go out, force myself to go to the clinic, even if I wanted to just stay at home and rest like Europeans do. But no, Japan or peer pressure is like you have to go to the clinic, you have to go to the hospital, you have to heal it immediately. And honestly, that's really hard on your body. Yes, if you can manage to do that, you can heal, you can recover more quickly than just resting at home, drinking some tea, taking some Paralen. But you still have to, drag yourself to the hospital. And also, you could potentially infect other people. You can pass your illness to other people at the clinic. Because, like I said, like I was joking with a friend here, there are quite a lot of healthy people at the clinic in Japan. They just go to socialize at the clinic, especially the elderly people. So you could potentially infect those people. And also, I feel like I'm not, this is just an anecdote, but I feel like this too good healthcare system, from my experience, is designed to keep people on the job. What I mean by that is, since if you get if you get sick, since the society expects you to just go to the clinic and recover from it, like immediately, like in 1 day or 2 days, I feel like there's more reason to just walk. It's not like you can relax because you have a illness. It's typically lasts 1 week or even more, depends on your age. Here in Europe, I feel like people just get rest for 1 week and return to work or school. But in Japan, I feel like you just have to go to the clinic, you have to recover immediately, and just go back to work immediately. There's no an excuse. I don't want to say an excuse, but like recovering phase exists, right? It doesn't really exist because it's too good. So I feel like that would keep people on rat race, keep making money, keep working. Because basically, like what I've been telling you guys, Japan's work culture is rather uh, live to work. So I never liked that culture. So I do like the health care system in Japan. It's affordable, accessible, like I just keep telling. But also, I don't really like, but I don't really like the culture that's surrounding. It's like I I can't just rely on my immune system or or my body to naturally recover from an illness. There's no an option to slack off in a way, because I feel like when you get sick, my understanding of that moment is that universe is telling you to just take some time off. But I feel like in Japanese culture, especially in a work culture, you're just expected to just see the doctor immediately and just get back to the rat race of earning money, pleasing your boss, and all that stuff. So for that reason, I do not like the culture that's surrounding the healthcare system. So, if I would summarize, I like the healthcare system in Japan. It's probably even better than the one in Europe, or much better than the one in the United States. I think I've never been to the States, save Hawaii. But I do not like the culture that's surrounding this perfect healthcare system. I actually prefer the European style. You know, get some tea, have some meds, Paralen, and eat some fruits. Anyway, thank you very much for watching. If you liked it, please give it a thumbs up. Subscribe if you haven't. And I'll see you in the next one. Until next time.